Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the country returns to high-risk status for COVID-19 as authorities in Metro Manila impose restrictions on unvaccinated and partially vaccinated people. The head of the vaccine expert panel calls on those who are fully vaccinated to get booster shots, saying the additional dose can increase protection up to 90% against the Omicron variant. And the tourism department is looking into reports that more hotels are violating quarantine policies following the incident with the so-called Poblacion Girl. Health Undersecretary and spokesperson Rosario Vergeire joins us live. Experts say COVID-19 is spreading at a rate they've never seen before. The country and Metro Manila are back at high-risk status for COVID-19 amid the alarming rise in cases. Meantime, the tourism department says it has apprehended another traveler who allegedly skipped quarantine. Authorities are also looking into more hotels for alleged quarantine breaches. Let's go straight to the source of the story. We have Health Undersecretary and spokesperson Rosario Vergeire. Yusek, welcome back to The Source and Happy New Year to you.
Magandang umaga po, ma'am, and Happy New Year to you.
All right. The whole of Philippines is now at high risk. Siguro for the benefit of everyone, Yusek, ano mo ba ang ibig sabihin nito? What does this mean?
Yes po, no? So nationally, we are at high-risk case classification. Pag tinignan po natin, from a low-risk case status last week, we are now at high risk because the 2-week growth rate, ibig sabihin, yung bilis po ng pagdami ng kaso ay po nationally, it's at 222%. And also, our average daily attack rate ay tumaas na rin. Ibig sabihin, yung pong number ng mga kaso, new cases affecting the population has risen. No? For this previous week, it's 1.07 cases for every 100,000 individuals. So now, our case trends are at high risk. Pero ang nakikita naman ho natin, yung ating hospital capacity ay hindi pa po umaabot ng 50%.
Okay. How is government preparing for this now that we are at high risk?
Yes, actually 2 weeks from ngayon ay nakapag-usap-usap na po no ang ating National Task Force, the Department of Health and other agencies, and the IATF has started preparing. We started mobilizing our teams para po yung ating mga ospital makapag-stockpile ng gamot, expand the number of beds. Ayun pong ating local governments, we met with them already so that they can intensify the response in the community. Ang pinaka-importante, we have activated our telemedicine services in all of our hospitals and even in our local government so that we can prevent congestion of our hospitals. We also have discussed with the local governments the immediate isolation of all of those with symptoms.
Yung telemedicine po, Yusek, that's very important because reports are saying that most of the cases that have been found to be positive are mild. Ang ibig sabihin po nun, pwede po yung tinatawag nga na telemedicine.
Yes, ma'am. Tama po yan. What we have observed for these past days, people are flocking the emergency rooms. Kaya talagang sinasabi ng mga ospital na pupuno dahil ang daming tao, nagpapanik sila, nasa ER po sila. But we are advising our public, meron ho tayong telemedicine services. If you are just feeling mild symptoms, we can do the telemedicine. Meron ho tayong mga doktor dyan at ito po naman po ay may PhilHealth benefit package no, na ibibigay so that it can be readily accessible to everybody.
Tell us, Yusek, paano ho yung telemedicine? I have to say that for one, ako po, I was able to do this for someone close to me in the past sa St. Luke's. But for those others who may want to call, paano ho ba yun? Tinatawagan lang ang ospital at sasabihin na meron ho ba kayong telemedicine available? And is that going to be covered, again, just to be clear, by the insurance company, by PhilHealth?
Yes, ma'am. We have specific telemedicine numbers, no? So we have partnered with 5 telemedicine providers na sila po nagbibigay nitong serbisyo, no? Aside from that, our hospitals, the DOH hospitals, have their own telemedicine hotlines as well. You don't need to call the number of the hospitals. There are specific numbers that you will call so that you can be able to access the telemedicine providers. Ito po, binibigay, it is covered by the Philippine Health Insurance Corporation as our outpatient isolation package. Aside from the telemedicine service with a doctor, there are also medications that are covered by PhilHealth once you go through this process.
Okay, and these numbers will be able to find in the DOH website.
Yes, ma'am. We had been asking, no, sa ating social media platforms itong LGU hotlines, our telemedicine numbers for this past day so that people are well informed.
All right, let's talk about cases. 4,084 as of Monday, that's yesterday, compared to 4,600 Sunday. Ibig sabihin po, from Sunday to Monday, bumaba po yung number of positive cases. But we need to put this into context, Undersecretary, because kahapon po, 2 labs were non-operational while 21 labs failed to actually submit their data. Would you say yung numero po natin kahapon na 4,084 could be an underestimation because of the number of labs that were not able to submit their data?
That's a possibility, ma'am, because kaya nga po kami, we do not take it by the day, no, as to the numbers. What we do every week, we compute it as a 7-day moving average so that we can be able to flatten, matanggal yung mga risk of biases because of the labs not reporting. So our 7-day moving average for now nationally is at 2,595. Mas stable po yung number na yan kaysa tinitignan natin yung numbers per day natin, which we all know is affected, no, by the submission of laboratories.
But would the non-submission of the labs be because of January 31, that being December 31, that being New Year's Eve, and then January 1 and 2, I believe, being weekends as well?
That is a factor, ma'am. There are a lot of factors why laboratories cannot submit. One would be over the weekend, our laboratories conduct their maintenance operations or procedures where they disinfect, they calibrate their machines. So usually, every Sunday, a lot of laboratories are not open. And then also, there was this Typhoon Odette that has affected some of our laboratories. And ngayon po, unti-unti pa lang silang nag-uumpisa ng kanilang operations. But we already have issued a memorandum to all of our laboratories that because of this increase in the number of cases, we expect them that they should be open 7 days. And for those which can operate 24/7, dapat po mag-operate sila.
When are you possibly expecting the numbers to peak?
Well, we have initial projections, ma'am, no, but these are very rough estimates as of now because of the uncertainties in the characteristics of this Omicron variant. But for now, we have initial projections which states that at the end of January, cases will peak.
And kung matuloy po yun, that cases will peak by end of January, what number are you looking at? In terms of if you prefer to give us the daily peak or even the weekly average?
For now, I do not like to disclose, ma'am, because these are rough estimates. We had a meeting yesterday. The assumptions are still not very tight and complete. We still need to finalize our numbers. What I can give the public as an information right now would be that with these initial estimates, the assumption would be based on the calculations that Omicron is 8 times more transmissible than Delta, and that the peak will happen by the end of January. As to the numbers, I won't give it now because it might, mislead people.
But would it be more than the numbers we saw during the Delta peak?
Yes, ma'am. It will be more than the numbers that we saw during the Delta peak.
Okay, so hindi naman po sa nananakot tayo, pero we're looking at what science is telling us about Omicron. As you mentioned, it's 8 times more, mas nakakahawa ng 8 times. No? In some reports nga po, even 10 times more. So hence, you're saying that the peak could surpass the peak during Delta. Just also another point I wanted to raise regarding this. If it is indeed Omicron, let's just say for now, because there is this assumption that this is Omicron, ano po, ano ho yung parang sinasabing lifespan nito? Because there was something I read that I believe in South Africa, it has a lifespan of about 1 month. Is that also the projection of the DOH?
Well, there are a lot of evidence around, going around na may lifespan about 1 month. Yung sa iba naman po, iba ang sinasabi. We are still trying to study, but based on our initial discussions and projections, once it peaks, slowly nagde-decline na yung mga number ng kaso. So sana po we can be able to achieve that also. Kaya lang, ang lagi naming sinasabi, even though there are projections, these numbers will be affected and can be prevented if we can be able to ramp up our efforts of prevention dun sa activities of cutting the transmission in the communities. So pag projection po, dapat hindi ho tayo masyadong itatala ang ating utak doon sa projected numbers, but what we should focus on would be what we can do to prevent the numbers from reaching that high.
So, because we are also talking about Omicron, ano na ho ba is the official statement of the Department of Health? Can you declare, or are you just assuming that there is already local transmission?
The assumption is there, because if for us to be able to declare that there is local transmission, we need definitive evidence. And we need this confirmation coming from our Philippine Genome Center through whole genome sequencing. As of now, we are doing random and purposive sampling because we have this limitation. But for now, we are now assuming that Omicron is in our communities, and we are having this transmission within our communities already. Actually, we have 3 local cases already that has been detected, and that the rise in the numbers, because according to our experts in the other countries, the cases doubled every 2 days in other countries. And that is what we are seeing right now. And the assumption is there, Omicron is in our communities already.
Yeah, because even I was looking at the numbers the past couple of days. Undersecretary, I remember we were at 250. It became 400. It became 800, 1632. Tapos naging 4,000. 4,600, ganun po yung numbers na lumalabas. Before we go on a break, I just wanted to get an update on the genome sequencing. How many so far of the Omicron cases do we have?
We now have a total of 14 Omicron cases based on the latest results that we have received. So for these 14 Omicron cases, we have 11 OFWs, returning travelers. 2 of those are foreign nationals, and then we have 3 local cases. Only 3 are active cases. The rest have finished their isolation and they are now declared recovered.
It will be good to also talk about testing and remind the public ano ho yung guidelines for testing. When should one test? Should it be antigen? Should it be RT-PCR testing? But we need to take a very short break. The Source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, health spokesperson Maria Rosario Vergeire. Yusek, I checked the numbers. Those tested yesterday based on the DOH numbers. It was at 18,000. I would say, personally, that's quite a low number. What is the goal for us to really be able to have a clear picture on the number of people infected?
Well, based from our experts' recommendations, for us to be able to reach that ideal number of tests, at least 100,000 tests per day. But as you have just mentioned, we had been observing that there is a decrease in the number of being tested. But in NCR, we have seen that NCR is starting to increase their testing. But for the other regions, we are really having that low number of tests. One of the factors that we are looking at is that most of the local governments right now are using rapid antigen tests for them to supplement the RT-PCR test that they have. So this can be one of the factors that we have right now for this low testing output.
So that is still being encouraged, the rapid antigen testing.
For now that we have increasing number of cases and for our local governments to be able to do this active case finding, we are allowing the use of the rapid antigen test, but it should be at the appropriate timing and should be
Okay.
at the appropriate situation. Like if people are symptomatic, you can use the rapid antigen test. If you know that people got exposed already, you can use the rapid antigen test, but you cannot use the antigen test for screening because you will get inaccurate results.
Let's repeat that because there was a part that we kind of lost the connection. We already hear of people, either friends or friends who are now positive. Help us refresh our memory now, Undersecretary. When should one get tested? First, let's start with those who might have been exposed.
Yes, for those who had been exposed, you should count on the 5th day from the day of exposure. So if you got exposed yesterday, you should count 5 days and you'll have your test on Friday. If you develop symptoms, you can immediately have your test already. You do not need to wait for that 5th day because this is when the time that the virus load in your body is very high so that you get accurate results. Now, if you're going to use this rapid antigen test, the most appropriate time and the most appropriate or the rational means of using this would be when you are symptomatic, because this is the time that antigen tests are most accurate. And also, if you had been exposed, you can be able to use the antigen test, but then again, you have to count the 5 days again.
But having a rapid antigen test, hindi ho ba, can also give you a false positive or false negative. So what should one do? For example, I feel let's sabihin natin I've been exposed. Symptomatic po ako, nag-antigen ako, pero negative. Is that going to tell me na negative na ho ba ako, or what should I do? Should I wait another 3 days or 5 days and get an RT-PCR test?
Yes, ma'am. We have a protocol for that. If you are symptomatic, you used antigen test and it turned out to be negative, you wait for 48 hours. You might get another antigen test or you may have your RT-PCR test. That is retesting with antigen. But if you get a positive result with antigen test, you don't need to repeat it again, especially if you used it, proper timing and the proper way of doing that, you are already positive.
So kahit nag-positive na po sa antigen, are you saying hindi na po necessary na mag-RT-PCR? Mag-isolate ka na ng 14 days?
Yes, ma'am. We should err on the side of caution, especially right now. No, for those using antigen test, you are symptomatic, you used it properly, and then once your test reveals that you are positive, it's positive already. You need to inform your local government so that they can properly guide you and manage you because you are sick and you should be isolated. Now, if there are people, we should be correlating also with symptoms. Some people will turn out positive in the antigen test, but they just used it to screen themselves. No, so this has to be properly evaluated. You need to isolate still, but you need to contact your attending physicians or your doctor so that you may be able to verify if really you are positive or not.
And of course, there are calls for what is being called mass free testing. Undersecretary Vergeire, please explain to us this. Who are eligible for free testing?
Everybody's eligible for free testing as long as you are symptomatic or you had been exposed to an individual who turned positive. We have this approach, which is risk-based testing, wherein we test based on our protocols those who have symptoms and those who had been confirmed to be exposed to a positive individual. These are the free tests that we are giving right now. But if you go to a facility and you are just you don't have symptoms and you were not exposed, you're just going to do it for screening, this will not be covered by the Philippine Health Insurance Corporation. So the risk-based testing would be the ones covered by government and provided for free by the government.
But how is that? For example, I want to go to a lab that does RT-PCR testing. Pupuntahan ho ba ako, let's say, gusto ko pong magpa-home service o mag-drive-through, what necessary papers must I show? Or is it enough for me to show them na sinisipon po ako o meron akong lagnat, hence hindi ho ako magbabayad ng RT-PCR?
First would be your PhilHealth number. Yung PhilHealth po, lahat naman tayo miyembro na because of universal healthcare. And then there is this case investigation form wherein you fill it out, you include your details there, and then you'd have that question if you have symptoms or not, if you have exposure or not. And that is the determinant if PhilHealth can cover it or not.
Mm-hmm. But would this be applicable to all hospitals and all labs?
It should be. It should be because all of these hospitals and laboratories are accredited by the Philippine Health Insurance Corporation.
Okay, so those are the guidelines for that. All right, hospital capacity, very important as well. The hospitals are saying exponential increase in the number of patients. I know that a while ago we were talking about it kasi kahit mild po, napupuno na po yung mga ER. Even for example, at St. Luke's, I heard an interview over teleradyo about this a while ago. Yung hospital capacity ho kasi, I was looking at the DOH numbers and the active cases are now at more or less 25,000. 19,000 are mild. Pero ito ho yung importante, there are 3,000 that are moderate, 1,500 that are severe, and 331 that are critical. All in all, roughly, that's about 5,000 individuals. Does this mean right now that there are 5,000 individuals who are being cared for in hospitals because they are either moderate, severe, or critical?
Yes, ma'am, that's right. No, so based on the numbers, the number of active, severe, and critical and moderate are accurate. No, yan po yun. But we have to understand that this number is cumulative. A patient who has a severe infection can stay in the hospital for 21 days or more. So this cannot be attributed solely to this increase in cases that we are having right now. So these patients might have been there since the start of December or second week of December, wherein our cases were still low during that time. So iyan po yung ating estado ngayon, but of course we are closely monitoring if these numbers are increasing by the day.
Right. That kasi while we're saying, here's the thing, while we're saying that the severe and critical can stay in the hospital for 21 days and they could have been there for two weeks or even 2.5 weeks or even nearing their third week, marami ho ngayon ang papasok din. Kumbaga mas mabagal po yung paglabas, yung pag-discharge rather than yung pagpasok. However, the silver lining, if we have to call it that right now, is that most cases are mild. But then again, we don't really have that big of a hospital capacity. So what right now, where are we in terms of hospital capacity? I heard we are at code white code ho ba?
Ngayon po, ang ating hospital capacity, hindi pa ho tayo nagko-code na mataas. Because as I've said, yun pong ating capacity has not reached 50% yet. Yun pong ating mga ospital ngayon, bagamat tumataas talaga ang mga pumupunta sa ospital, pero pag tinignan ho natin, most of these are mild cases. As you have said a while ago, yung severe and critical natin madami, so it takes up itong mga beds na available natin ngayon. And mas mabagal po tayo makapag-discharge kapag severe and critical. That's why we are encouraging all of our citizens, kapag mild ang symptoms natin, let's use telemedicine. Do not go to the hospitals yet. Let's preserve our hospitals for our severe and critical cases so that pag magkakaroon po tayo ng ganun, may enough beds tayo for them.
Okay, we are again on alert level 3. And is this enough to curb the increase in COVID-19 cases in the country? We will be taking a short break. The source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, health spokesperson Maria Rosario Vergeire. We are on alert level 3. That's Metro Manila. But latest report also, USEC, sinama na rin daw ang Bulacan, Cavite, and Rizal. That starts on January 5, tomorrow.
Yes, ma'am. So we confirm that. We have the IATF has approved our recommendation that Cavite, Rizal, and Laguna be included dito po sa alert level 3 because we have seen the increase in the number of cases and they have reached high risk for their case trend. So continuously minomonitor po natin, may mga ibang areas pa rin na nagsho-show ng pagdoble po ng mga numero ng kaso nila in the past days and we are continuously monitoring them.
So yeah, we need to keep updated here, no, because daily this could change. Pwedeng may madagdag. Posible talagang meron pang mga madagdag na mga lugar under alert level 3. Before we went on a break, I was asking that question. Right now, do you think that alert level 3 is enough to prevent a surge to the point na hindi po natin kayanin ang mga mai-infect ng COVID?
Well, for now, ma'am, based on our metrics, it's really alert level 3 because of our healthcare system na hindi naman po na tumataas pa ng ganun to flag or to alarm us na kailangan pang itaas yung ating alert level. But this doesn't preclude local governments for them to stricter measures among their constituents in their localities. So sa ngayon po, kasama sa alert level 3, nagre-restrict na tayo ng age, Yung ating pong mga matatanda at saka yung pong mga bata, lalabas lang sila for essentials, for exercise, but going to establishments ay hindi na muna natin papayagan. The National Capital Region mayors have instituted a resolution wherein unvaccinated are supposed to stay at home so that we can better protect them. So ito po yung mga measures na ginagawa so that they can supplement also these alert level 3 restrictions that we have for the national government.
Also, is there anything you can tell the public, USEC, regarding the Omicron variant? What should we watch out for? Is there anything different about this?
Yes, ma'am. Based on experience, based on existing evidences, the Omicron variant has a shorter incubation period compared to the other variants of concern. So if, for example, in the Delta, with the Delta variant, the average, the incubation period wherein you start your symptoms once you are exposed is about 5 days. For the Omicron variant, it's shorter. It's about 3 days. So you get infected or you get exposed today, you might have your symptoms in about 2 days already. So this is one. And with that, the implication would be that a lot of cases will be going around without the test and without being isolated. Most of the cases right now are mild. Marami po tayong nakikita, walang sintomas, pero pag tinest, nagpa-positive. So we need to be very cautious also on that. Kailangan po talaga na once na-expose tayo, we immediately quarantine ourselves so that we can cut the transmission in the community.
Right, because ang bilis po in 3 days you can get that you can get the virus already. So in fact, pwede rin ho magpa-test na on the 3rd day, even if you're asymptomatic, if you've been exposed, because unlike the Delta, which has an incubation period of 5 days. Undersecretary, as siguro just a follow-up, do you think that face shields, government should reconsider the use of face shields again?
Well, the face shield naman po is voluntary, hanggang sa ngayon, katulad po ako, pag lumalabas ako, nag-face shield pa rin ako kahit hindi kailangan. Pero pag tinignan ho natin yung ating guidelines, in alert level 4, local governments and establishments can already i-regulate na, sila na po yung magsasabi kung gusto nilang magpa-face shield sa mga tao o hindi. Pero pagdating natin sa alert level 5, mandato na po yan, it's mandated. Everybody will be wearing face shields again once we go outside of our houses. But for now, it's voluntary. Pinag-uusapan din po yan ng ating mga eksperto kung kailangan natin ibalik. But with alert level 3 po, it's still voluntary.
Health spokesperson Maria Rosario Vergeire, ma'am, maraming salamat po sa inyong oras.
Maraming salamat po.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.